Hi, good evening. My name is Sarah, and this is my video for the role play communication. I chose to do nurse bullying because it's something that I have experienced in my career, and it's something that I feel like the majority of nurses have had to handle at one point or another. This is a scenario where we see two nurses communicating, and one of them is a new grad and ends up getting bullied. So stick with me and we will get started. Thank you. So, working in healthcare is one of the highest stress environments that nurses face. Um, it's even can take the nicest and most competent nurses and push us to our limits. In a crisis, a nurse can sometimes lash out at another nurse, and it just comes off very abrupt and harsh. However, there is a difference between a nurse lashing out to her coworker and a nurse being a bully. So, bullying is defined by the American Nurses Association as repeated, unwanted, harmful actions intended to humiliate, offend, and cause distress to the recipient. This is a serious issue that threatens patient safety, a nurse's safety, and their sanity, and the overall reputation of the nursing profession. In 1986, a nursing professor, Judith Meissner, coined the term nurses eat their young. We've all heard it, and we know pretty much what it means. It's pretty simple. It's bullying and harassing a new grad nurse. Researchers have proved that at least 85% of nurses have been bullied at some point in their nursing career. 85% is very high. I could almost even guarantee that this number has probably gotten higher. Also, a recent study done at Vanderbilt University Medical Center showed that 60% of new nurses leave their first position within 6 months due to some form of verbal abuse or harsh treatment on the job. So when we discuss bullying from a nurse to nurse, there are certain behaviors that we look for. So these behaviors can be verbal criticism, name calling, intimidation, blaming, racial slurs, physical violence, being threatening, sabotaging another nurse, or just having unfair assignments. And the list goes on. There's multiple ways that one nurse can bully another nurse. So now, going over all of this research, I'm going to go into the scene that I have created for your viewing pleasure. We're going to be looking at a new grad nurse interacting with the charge nurse who has been a nurse for a very long period of time. And unfortunately, this very experienced nurse isn't being the charge nurse and the educator that she should be, and is bullying this new grad nurse. So I'm going to take my laptop and we're going to go check it out. So here we have Nurse Millie. Nurse Millie is a new grad nurse, and she's only been on the floor for about a month. So she's got a lot of questions, and she's about to do some wound care that she's never done before. Here we have our patient Smith, who's very sick after receiving some burn wounds to her legs and abdomen. So Nurse Millie is a little scared to start this wound care. So she goes and she asks her fellow charge nurse, Maureen Walsh. Maureen has been doing this for a long time, and she's just stressed out and burnt out. Oh no, the family member of Miss Smith needs to leave the room. Go away. Sorry, we have to excuse the family member. But Maureen Walsh is being very, very abrupt with Nurse Millie when Nurse Millie goes in to ask her a question. Hi, Nurse Maureen. I'm going to do some wound care. Do you mind helping me out? Why? You don't know how to do wound care already? You just graduated. You should know how to do these things by now. What's the matter? Why do I have to come in here and help you with this? Well, I'm just feeling a little uneasy about it. I'm new and I don't want to do something wrong and mess up the patient. Do you mind when you have a minute? What do you mean I don't have a minute? I've got to watch these 5 patients. I've got to talk to the doctors, talk to the family, and you want me to help you too? I don't want to do that. All I want to do is play card games. That's all nurses really want to do. Ugh, you are so frustrating, Nurse Millie. I just can't even look at you right now. Ugh. And now we see poor Nurse Millie is all by herself doing wound care. Hi, Miss Smith. I just want to do your wound care. Do. Oh my goodness. I don't know what I am doing. Oh my goodness. Oh gosh. Ugh. So now that the wound care has been completed, Nurse Millie is feeling very, very stressed out. The family member is obviously upset at Nurse Millie because she knows that she didn't do the wound care right. She feels like she's put the patient at risk for infection and other very scary complications. So at this point, she leaves patient Smith at the bedside to go talk to somebody else about this wound care and not consult anymore with the charge nurse. Bye, Miss Smith. So sorry about your wound care. So sorry, family member. We are going to do better next time. So now that we saw that role play get done, what could we have done better in this situation? Or what could Nurse Millie have done to prevent this from happening in the future and to prevent putting the patient at risk and putting more stress onto her and not feeling like she can go and talk to her charge nurse? There's a few things that I would do, and that looking at my readings that tell us what we can do to help prevent bullying in the workplace. So first, we want to recognize the bullying behavior. Is this nurse bullying me? What is she saying? What is she doing? And if you feel like it's happening on more than one occasion, then start documenting that behavior. Every time this happens, write it down, put the date next to it, and what happened, what was said. So you can look back and decide for yourself, is this bullying behavior? If you feel like it is bullying behavior, then you want to separate yourself if you can. Now, unfortunately, part of our jobs is majorly communicating with others and advocating for our patients. So we need to find ways to handle this appropriately and professionally. So we can't always separate ourselves, especially from our charge nurse. We are going to have to deal with them on more than one occasion. So if you really can't separate yourself, then it's time to speak up. You can't suffer in silence forever. You'll only burn yourself out. You'll be miserable, and ultimately, you won't make it you won't make it working in the long run. So speak up. Even though you're a new grad nurse, you're still a nurse. You still went to school, you got your education, and you deserve to be respected just as much as that nurse that might have 30 more years of experience. Doesn't matter. You still deserve respect. And now, after you've spoken up for yourself, it's time to confront the bullying behavior. So it's good to have the documentation that you can pull up for yourself and say, this happened on this date. I felt like I was treated in this way, and what can we do to prevent this from happening in the future? And if you really feel like that nurse is not listening or not taking your words into consideration, then it's time to climb the ladder and talk to the person above that. So whether that be your clinical coordinator, your nurse manager, the administration, you just keep going up until you feel like you have been listened to. And then what are behaviors do you feel like are crucial enough to report up? And hopefully after all of that has been done, that you feel like you have made a difference and that you feel that you have been listened to, and you feel like the problem has been taken care of. Overall, nurse-to-nurse bullying in the workforce is a huge problem. it's destructible, and it has no place in a profession that is dedicated to caring for others. I found a statistic that by the year 2022, the U.S. Bureau of Labor Statistics project a shortage of 1.05 million nurses. With this increasing number of nursing shortage, if we keep bullying our own, then that number is going to ultimately increase. So what would I do to help lower these numbers is, if I can't advocate for myself, then how can I advocate for my patient? So putting yourself first and making sure that your voice is being listened to by your nurse manager, by administration, by your colleagues, it's so important. You shouldn't have to feel like coming to work is hostile for you and your mind. You should feel comfortable knowing that you have others to rely on. Yes, we're not always going to get along with every other colleague that comes into our lives, and we don't have to get along with everybody. We have to make sure that your safety and the patient's safety is put first every single time. So this concludes my video. I hope that in the future that bullying will always be there, but I hope that nurses can consider that we are all in this together, and patient safety and our own mindset is so important. And why break others down when we can be boasting everybody up? So thank you for listening. That is everything I feel like I have said, and have a great night.